My name is Dr. James Bonner. I'm a career emergency medicine physician, 34 years in practice. Current state, my titles are that I'm the chairman of the Departments of Emergency Medicine at Inspira Hospital, Mullica Hill, New Jersey, and Woodbury, New Jersey. I also serve as chairman of the board of Inspira's hospitals. So the business problem we were trying to solve when we engaged Trindent was patient throughput. The movement of the patient from their arrival in the emergency department through this organization to the floor to discharge from the organization to their safe disposition, whether that be home or a facility, etc. Well, specific to the emergency department, I'll address that first. Certainly left without treatment is a major indicator of the health of any emergency department. We had a significant LWT problem, particularly during COVID. So the left without treatments, or the LWTs, is a legitimate metric across the nation looking at the health of that emergency department and its performance. When patients arrive seeking our care and we end up turning them away for whatever reason, usually wait time, that's a failure. We really want zero. You know, the national average for a department our size is 2.6%. The national goal really would be 2%. And with Trindent's help, we put a stretch goal of 1.5%. We were able to take a department that was suffering 3% LWTs and get that down to a stretch goal of 1.5%. In my 34-year career, I've had the exposure of multiple consulting projects. Many speak about the emergency department being the front door of the organization, but few realize that for the front door of the organization to work, it is a process-rich environment dependent on all the other pieces of the organization for its health. What was different about Trindent is they certainly looked at the front-end metrics of the department, as well as the metrics of the workup of a patient, what was involved in that. But what was completely different is we've never had anyone look at EVS's impact on inpatient discharge turnaround times and how that impacted admit holds in the emergency department. We've never seen a consulting project that looked at the time of day of discharge and impacting that time of day and how that met the cadence of the admissions that occur every day in the emergency department, where the volume builds, the holds occur mid-afternoon, the LWTs occur at 9 o'clock at night, and they were able to not only document that, they were able to impact it, moving everything forward. Another unique piece of this consulting project was the consultants spent time with those doing the tasks, particularly nursing. We were able to identify a practice that had been expunged on a couple of different occasions, but the time from the nurse having an admitted patient, for that nurse to be able to give report to the receiving nurse on the inpatient arena was 51 minutes of the ED nurse's time. We were able to identify that. When you looked at that in a global fashion, if we could take that 51 minutes and get it down to 15, that was almost 7,000 hours of nurse time saved, with a significant economic impact, but more importantly, a significant impact on the efficiency of both sides of the nursing equation. So the experience working with the Trindent consultants was unique. It was invasive. The consultants were in our space. They were in the space of the pivot nurse in triage. They were in the space of the security guard. They were in the space of the registrar. They were in the space of the bedside nurse, of the bedside clinicians, of the radiographers, of the lab, of the inpatient nurses, of the lab turnaround time, as I said. So it was a shoulder-to-shoulder experience. It wasn't simply 9 to 5. You know, they observed all shifts, And there's a different rhythm and pace from daytime to evening, so that the view of our landscape we felt was more broad-based than what we had seen before. So the results that Trindent delivered were impressive. The LWT reduction from 3% to 1.5 is huge. There's a significant quality impact in that regard. There's a significant economic impact in that regard, all positive to the organization. The reduction in time spent giving report from 51 minutes to 15 minutes. We've had 100% capture of that project with ever improving time spent on the project. The environmental services turnaround time. They were able to identify some dead zones in that group's workday, where toward the end of the shift or the beginning of the shift, there really wasn't much activity. Just the simple stocking of the carts for the next shift, the granularity of that improvement allows the environmental services folks to turn a room in a much more efficient timeline, making that room available for an admission waiting in the emergency department. When you look at the care coordination side, the visibility of a potential discharge, doing that a day ahead so that whatever barriers to discharge exist could be addressed earlier in the process, allows us to get that patient out of the hospital by 11, 12, or 1 versus 8, 9, 10 o'clock at night. So it's a huge operational savings. From day one of the project, the steps required to have responsibility and accountability for the projects that Trindent had started, that transition has been discussed and operationalized from day one. And if we can sustain these gains, then the consultant project pays for itself year after year after year. I personally was very impressed. No consulting project that I've lived through has looked at the entire house and how every incremental time wasted impacts the patient's throughput, the patient's care plan, the patient's safety, as well as the staff, as well as those all involved in the care of that patient. So I would recommend Trindent to anyone who's looking for a system-wide approach to their throughput issues.